So for those of you who don't know me, my name is Oliver Chang. I'm at the VA. I do Dermpath here. I did my fellowship at UW. Understanding normal is really important because you're trying to figure out whether the cells and whether the architecture are still trying to perform a normal, appropriate function. The epidermis, which is the uppermost compartment of skin, is maintained by basal keratinocytes that are constantly regenerating. And as they ascend in the epidermis, they terminally differentiate into this cornified envelope. 4 layers: basal, squamous, granular, and cornified. In the basal layer, these are where you find the mitotically active cells, and they're attached to the underlying basal membrane by hemidesmosomes. The basal layer is also where you find other cellular constituents of the epidermis, including melanocytes and Merkel cells. So next we have the squamous layer. These are the squamous cells that we all know and love. As they go up toward the surface, squamous cells will start to flatten, become more eosinophilic. Keratin filaments are what give keratinocytes and all other epithelial cells the ability to resist stress, mechanical stress. And then some of these proteins eventually condense into these keratohyalin granules in the next layer, which is the granular layer. These are flattened keratinocytes, 1 to 3 cell layers thick, depending on where you are in the body. And they have these keratohyalin granules. So this is also the layer where keratinocytes will lose their organelles and stop metabolic activity as they reach the very top and they flatten into the stratum corneum. On electron microscopy, you can also find things called Odlin bodies, and these are little lamellar bodies containing granules that are secreted into the intercellular spaces, which adds to the permeability barrier, so it makes your skin relatively waterproof. This is illustrating the intercellular junctions, which you normally don't really see. They're not conspicuous unless there's spongiosis or edema in the epidermis. And you see all these little train tracks in between keratinocytes. And the main component of these is desmosomes. They're the major intercellular adhesion complex in the epidermis. And they anchor keratin filaments to the cell membrane, and it links up with neighboring keratinocytes. There are a bunch of proteins in desmosomes, but the major one that we'll talk about just very briefly is the cadherin family, because these include, this includes desmogliin, desmocolin, and here's an electron microscopy of a desmosome. I'm going to talk a little bit about variability of how the skin can look at different parts of the body. Super thick, super compact stratum corneum. We even have a stratum lucidum, this pink layer right here, prominent granular layer. So this is from palms, soles. Lots of smooth muscle bundles. This happens to be the nipple. You have 2 sides to the lip: cutaneous side with the muscle and adnexal structures. You'll have hair. You'll have a keratinizing epidermis. And then the mucosal side, which is a non-keratinizing epidermis, you can't see, no adnexal structures, and you're going to have stuff like minor salivary glands. Right, this is the ear. This is the big band of cartilage. The ear is tough to evaluate sometimes because a lot of the microanatomy here is a little bit different. The epidermis can look weird. The dermis can look pretty dense and fibrotic, even though it's not. And then you have cartilage there. Keratinocytes we already talked about. They perform the barrier function. Melanocytes are part of the pigmentary system. Here's a melanocyte. Then you have Langerhans cells, and they participate in the immune function, and Merkel cells, which is part of mechanoreception. And melanocytes produce melanin, and then they give it away to neighboring keratinocytes. Melanin is important because it protects the basal layer of keratinocytes. That's where all the mitotic activity is happening. That's where you don't want UV radiation to strike, producing mutations or DNA damage. And they do this by either absorbing the radiation or scattering it. Transport of melanin will occur along these dendritic processes. You don't see on H&E, but if you stain with like S100 or MART1, MELANA, you'll see that melanocytes actually wrap all these long dendrites around neighboring keratinocytes. The ratio of melanocytes to keratinocytes also really varies, anywhere from like 1 to 4 to 1 to 10. Differences in skin pigmentation is because of the melanin that's produced. It's not the number of melanocytes. Melanocytes are everywhere. They're derived from the neural crest. They belong in basically every body compartment. They're in the epidermis, hair follicles, mucosal membranes. On the left here, we see an H&E stain section, and all of these pigmented cells are keratinocytes. We have a lone melanocyte here. All these are keratinocytes with that brown melanin pigment. And on the right is a silver stained Fontana-Masson. This will highlight melanin. So it's important to understand that immunohistochemistry, when you get S100 or MART1 or MELANA, SOX10, they don't stain melanin. They're, well, some of them are getting melanosomes, which is the organelle that produces melanin. But this special stain, this silver stain, actually gets melanin. So this is something that you would get if you were concerned about something like albinism, where melanocytes might be present, but there's greatly reduced or completely absent melanin. Okay, on the left here, it looks like it's maybe a MART1 or MELANA, and on the right, there's no melanocytes anywhere here. There's a lot of other IHC that'll get melanocytes because of its neural crest derivation. You can get neural markers, S100, SOX10, MITF, HMB45. Okay, Merkel cells. Merkel cells. The only time we ever talk about Merkel cells is Merkel cell carcinoma. And it's not even known whether Merkel cell carcinoma is derived from Merkel cells or a precursor cell to Merkel cells. Merkel cells are located along the basal epidermis and in the dermis. They're part of the mechanoreceptor network. You can't see them on normal H&E stain sections. You need cytokeratins. CK20 is a popular one. You can also use CAM 5.2. Neuroendocrine markers will also work. Here are some of the neural structures that you'll see. So starting most superficially at the DEJ is the Merkel murite complex or the Merkel disc. You're never going to see these. And they're involved in touch sensation. Then Meissner corpuscles are in the superficial dermis. You'll see these. You'll see these in toes, fingertips. Fine touch and vibration. Then there are these things called the Ruffini organs or the bulbous corpuscles. They're in the mid-dermis. Apparently you can see these. I've never looked out for one. And they're involved in stretching of skin, vibration and pressure. And then you have the Pacinian corpuscles in the deep dermis that respond to vibration and pressure. The Meissner and the Pacinian corpuscles are the two that you'll most likely see. These are Langerhans cells. Langerhans cells staining with S100. You have these sentinel cells, Langerhans cells, that hang out in the epidermis, and they basically recognize and process external antigens. Then they squirrel away to a lymphatic, go to a lymph node, and show it to T cells. And then you can mount a T cell host response. T cells especially are the ones that we're most concerned with because they're the ones involved in a lot of inflammatory processes as well as the most common hematopoietic neoplasm, CTCL, or cutaneous T-cell lymphoma in the skin. The dermis is essentially just this mucopolysaccharide gel that's held in place by a scaffolding of collagen and elastin. So collagen is a major extracellular matrix. It's mainly synthesized by fibroblasts, but other cells can also make it. Keratinocytes can make it, endothelial cells, smooth muscle cells. The most abundant collagen is type 1, and it'll link up with type 3 collagen to make the broad bands that we normally see in H&E stained sections. This is an elastin stain. There is a good demarcation here from the papillary dermis and the reticular dermis. So papillary dermis, you're going to have like fine, wispy collagen, and then this kind of really delicate, thin, wispy elastic fibers that are illustrated here. And then they kind of turn into the papillary dermis. And then below, really thick bands of elastin. They're all arranged parallel or horizontally to the epidermis. Even on H&E, if you pay attention, you can tell the difference between the quality of the papillary versus the reticular dermis. Here is sun damage, this gray band of fried elastin. And you see like all of these things that are in this area, like vessels and nerves. So in elderly patients, when you see those like blood spots, that's caused by a shearing force because the scaffolding that's holding them in place that can resist that mechanical stress is just gone. Last thing in the skin, adnexal structures. Follicles, glands, ducts. 4 classes of hair: terminal hair that you'll see on your scalp, beard. Vellus hair you're going to see everywhere. And sebaceous, I mean, you'll have sebaceous glands everywhere, but especially chest, back, face. The microanatomy will start at the bottom. We have the dermal papilla that opposes these germinative matrical cells. And this is where melanocytes live. That gives your hair pigment. This whole region is the hair bulb, and it's got the nucleated portion of the hair shaft, which is called the keratogenous zone. And it also has the inner root sheath, which is 2 layers. They're very inconspicuous. And then the outer root sheath. And then you get into the isthmus, and then the infundibulum, and then you're out on the surface. Hair cycle, there's 3 phases: anagen, catagen, telogen. In normal hair, 99 to 100% of your hair is going to be anagen. Catagen is the rarest because that's the transition phase between active growth and a resting phase, which is telogen. Okay, glands. Merocrine, apocrine, holocrine. Merocrine secretion is when the glandular cells release whatever they're making without losing any part of their cellular structure. So sweat glands are an example of this. They just make sweat and they put sweat into the lumen, up a duct, and the cells are still intact. Apocrine secretion, this is apocrine glands. A part of the cell decapitates, and that pinched off portion is what makes the secretion. And then holocrine secretion is what sebaceous glands do, which is the entire cell explodes and just sloughs off, and that is the secretion. That's sebum. Sebaceous glands will develop the lateral aspect of hair follicles. There are exceptions to this. There are certain areas in the body where they can exit directly onto the skin surface, like eyelids, lips, some areas in the face, nipples, labia. Sebum is something that contributes to waterproofing skin, prevention of water loss, and it inhibits microorganism growth. Sweat glands, the coil contains both the glandular component and the ductal component. And then the ductal component will exit as a straight line all the way to the surface of the skin. And these don't attach to a hair follicle, they just exist on their own. And they're situated within this loose connective tissue and ground substance. It's usually rich in mucin. So if you get a mucin stain, don't be surprised if the area around eccrine glands light up. IHC for eccrine glands and ducts. CAM 5.2 and BEREP4 are just going to mark the secretory units. So you can see the ductal parts of the coil are negative. So these are the cells that are actually producing sweat, not carrying it away. EMA will highlight lumens and the intracellular canaliculi. EMA can be helpful in eccrine tumors where you see like little spaces and you're wondering, is that like an intracytoplasmic vacuole or is it trying to make a ductal structure with that ductal cuticle? And then the S100 IHC will highlight the myoepithelial layer around these eccrine structures. Okay, that's it. From normal skin, I think I went over all the structures that you'll see. But remember, like, you don't really think of these structures individually. You see skin as a whole. Think about the function. Think about what things are supposed to be doing and how good of a job they are at doing it. And I think that's going to be a good foundation, a good start to how to approach skin specimens.